Hello, and welcome to It's Your Lymph, a podcast about all things immunity, health, beauty, and longevity. I'm your host, Lisa Levitt-Gainsler, and I've dedicated my entire career to working with people's lymphatic systems because the results are nothing short of astonishing. Come along as we reconnect to the flow of life and learn how to harness the power of lymph. All right, everybody, I am so excited for this episode of It's Your Lymph podcast. I have been waiting patiently for our guest who goes by Dr. B, Ask the Dentist on Instagram, Dr. Mark Barain. He is a functional dentist who emphasizes that our overall health is influenced by the condition of our oral microbiome. In addition to be a best-selling author of the 8-Hour Sleep Paradox and TEDx speaker, he's a functional dentist who recognizes the crucial link between oral health and overall well-being. So welcome to It's Your Lymph podcast. Thank you so much for taking the time with us today.
Thank you, Lisa. And I'm excited about today's conversation. The lymph tissue, which is part of the whole picture, but dentistry doesn't have much to offer there. And we'll talk about that, but it is a fascinating area.
Yes, I'm so interested, especially, with everyone's talking about like the gut microbiome and all these different microbiomes. And I'm so deeply fascinated about the oral microbiome. But before we begin, I'd like to start off with some icebreaker questions. The first one, my favorite question, what is your favorite place you've traveled?
Oh, wow. I'll just respond first thing in the head, but there are a lot of fascinating areas. And then as I tell you what first popped into my head, then I'm going to want to tell you about all the others. But I would say Sicily.
Oh, I was just there last summer.
Oh, my God. Talk about diversity and interest and good food, healthy lifestyle, slow pace of life, great weather, Mediterranean diet, Mediterranean climate, Mediterranean geography, history, ancestral history. There was a museum that we went to that had a lot of skulls in it. Every time I see skulls, I get very excited.
Oh, because of the teeth.
Well, teeth and facial development, and it's a glimpse at our ancestors. And
yes,
it's important.
I studied medical anthropology in college, and anthropology is what really got me interested. That led to sort of my interest in lymph. But yes, so studying the skulls and the development of the jaw, that's so great. Oh, so were you in the east or the west or
everywhere? We've been there twice. We've driven the whole island inland. We love it. We think it's fantastic. We've took our kids there. All 3 daughters in the back of the car and different Airbnb every night. It's a very easy, wonderful place to travel and a little bit of a language barrier. But if you're talking about food, it's universal, right?
Exactly. I agree with that. That's why I asked this question about travel, because I really do think it is so important for our soul and our joy and purpose and meaning. So thank you. I love that you were in Sicily. Okay, next question. If your lymph could talk, what would it say?
Oh, you're in trouble.
No.
Big trouble.
No.
In the mouth. Lots of inflammation, lots of work to do.
You personally or people in general?
Oh, in general. If lymph could talk, it would be broadcasting from the mouth area.
Tell us more. Dive into that, please.
Well, the mouth is kind of a hot spot in the body. I call it the pole position. It's a racing term. It's the first car out. You fight to get there, because there's an advantage to being there. But you're also exposed to a lot of danger because everyone else is chasing you. It's the opening to the digestive tract, to the respiratory tract. It's the first place that the environment is being sampled, typically by dissolving compounds in saliva, smell. I count that as part of that whole oral facial complex.
You mean how our breath smells or how we smell through the nose?
No, just the external environment or someone else's breath for that matter. Yes. That is telltale sign. And from a kind of primal instinct, we worry about certain smells. Although there's argument that we're losing our sense of smell and therefore are not relying on it as much. But I don't think that's true. I think that can be awakened. But to answer your question, I think the immune system and the lymphatic system as well, and there is a lymph system in teeth, believe it or not, is very active as well as everything else. Bleeding gums, it's one of the most prevalent signs of disease on this planet. Decay, tooth decay, it is the #1 disease on the planet. These are all manifestations of oral disease, dysbiosis of the oral microbiome, but the lymph tissue is part of that, and it's working hard.
Okay, I want to get a little deeper into this because, funnily enough, I just came from the dentist right before this interview. I know I have this. I was like sort of scared to talk to you, but also very excited to talk to you because I probably, like a lot of people you hear, have hated going to the dentist. And since I was a kid, I think I had 12 cavities before I was 12 years old. I've had many root canals. I never had braces or retainer. My teeth were always straight, but it's just like not great inside. But I don't eat sugar. When I was younger, I didn't eat a lot of sugar, but there's just something going on. And now I have like inflammation where they're doing that.
Deep cleanings.
Yes.
Scale and root planing, right? Which is the beginnings of gum disease, gingivitis, inflammation in the body, not just in the mouth. It spreads to the rest of the body.
She's really like concerned. And I'm like, okay, you're concerned. So break that down for our listeners, what that means, because I have never heard about that before.
As I said, gum disease is very prevalent. It is a very common disease. It has an inflammatory component to it. It is a little bit of an overreaction. It is a chronic disease, and it is very difficult to reverse. Dentistry has had its regimens on dealing with it. One is the scale and root planing. We call that SRP. That's the first step. If there's bone loss and areas we can't get to, then you go to surgery. That means pulling back the gums, getting to this crucial, critical area of where a lot of things are happening, including lymph. And I have to admit, I did a little research for this episode because dentistry and the curriculum it's just not mentioned. There's one mention in my dental curriculum. This was 38 years ago on lymph, and it was the sternomastoid chain of lymph tissue. And of course, we're taught to palpate for that because that could be an early sign of an odontogenic tooth-based infection. But again, as we said with the mouth, that pole position, the inflammation around the gums, where the gums meet the teeth, that is a very unique part of the body. There's no other part of the body like it. It's an area where a inanimate object, the tooth, erupts outside of the body. The fingernail is different. That's just an extension. That's a different type of skin. It's got more keratin in it, and it's got a different anatomy. And because of that, it's like a feeding tube. Think of a feeding tube. Feeding tubes are chronically get infected. The bacteria can go on the tube and into the body and cause sepsis. And that's what the body's dealing with 24/7, is managing that area to prevent bacteria from the mouth and from outside, outside of the mouth, from the outside environment, from getting inside the body where they don't belong and could potentially take you down. I mean, kill you, cause organ distress, cause infection and short-term and long-term infection. So how do you maintain that, and why does it go wrong so quickly? It's pretty much based on our environment. It's our diet. It's the inability to keep our mouths closed at night or during the day because we can't breathe through our nose. It's about the saliva, the pH change in the saliva. It's really mostly about the condition of the oral microbiome. Just like the gut microbiome, when that's off, you're going to be a very unhealthy person. It has effects on the brain. There's a gut-brain axis, just as there is with the oral microbiome. And we have now discovered and discussed, and studies are pending and coming, of course, and there's always that long delay, which is the problem with studies, of course, but long studies are better than short studies. The data is more accurate. So yes, I mean, inflammation in the mouth is a serious thing, but most of us have it. Most of us will get it, and it can be prevented, and that is what dentistry is supposed to do. I could argue that we're not very good at it, and there are arms of dentistry that are better at it, but it is something that unfortunately a lot of people deal with, and that's why we don't like going to see the dentist. I mean, it is uncomfortable, and it's difficult. It's expensive. Insurance covers less of that. If you don't have insurance, it's expensive, but it is one of the big diseases on our planet today, and we can prevent it.
Probably a lot of the listeners who listen in eat an anti-inflammatory diet. I'm pretty good about my diet. So like you said, there's other contributing factors that you would recommend. What are some of the other diet, food, herbs? I know you recommend curcumin, B3. There's a lot of supplements you recommend for people. Let's just jump in there and have you talk about some of those.
Mostly because we can't get what we're supposed to with our food supply. So I can talk about that later. One of the big contributors is the inability to breathe through our nose. And because of that, our mouth is open, and that dries out the mouth. And saliva is key to the health and wealth of that biome, of the oral microbiome. pH will drop if you have less saliva. It can thicken. Most good dentists can look at the consistency of saliva and tell you that something is awry. It's supposed to be very fluid, very viscous. It can't be ropey or stringy. It has to be very clear. It can't have any color to it. Smell is a big indicator. So saliva is part of that. Saliva, which houses and is the basis for the oral microbiome, is greatly impacted by a dry mouth. Also by medications. Medications have an effect on, especially the psychotropics, but there are many others, blood pressure medications. I mean, most of us are on some form of medication after age 55 in this country.
Okay, wait, but back up for a second. The psychotropics give you dry mouth? I mean, marijuana, I understand, but...
Well, I'm talking about like anti-depression medication.
Got it. Not like plant-based.
Oh, well, vaping, certainly THC use, all of those things can lead to dry mouth as well. And it's not just the smoking. You know, people think, oh, if I smoke, of course my mouth will be altered due to a combustible product. Vaping, it's about the propylene glycol.
I know. That's what I tell people all the time. I'm like, please do not with the vape. Please just know those butane in there. It's so terrible. And so I know you are a big proponent of breathing through the nose. I am a yogi. I've been doing yoga for over 30 years. And so, you know, I've also been reading about how people, and you as well, recommend mouth taping. And I love what you were saying about kids, you know, that moms think it's so cute when their kids snore. But when I was a kid, my brother, we used to call him Schnucka because of the way he snored was this, right? And he is now in his 50s has sleep apnea and is on that machine. So it wasn't cute, but I know some people think it's cute. But how am I going to tape my 12-year-old's mouth?
It's a great question. First of all, at age 12, you can tape a child's mouth. We kind of draw the line at 1 or 2 years old. I have helped parents taping at that age, but that's a bit of an exception. But it's something you would do with your 12-year-old. You would do it together. You would sit at the table, you put your hands on the table, tape, rest, no visual stimuli, just close your eyes and see if at a very low respiratory rate, metabolic rate, if you can tape for more than 3 minutes. I mean, it's like holding your breath for some people that cannot breathe through their nose. So if that can be done, then you would start taping at night. You can tape vertically at first. They also have what I call girdle tape or myotape. It just is around the lips. It keeps the lips closed. You're not closing the jaw. The jaw is at rest. The teeth are apart. You're just reminding the lips to stay shut, especially at night when you're relaxed in deep sleep. You know, your muscle tone relaxes due to, you know, in REM sleep. You want those lips closed. You don't want your mouth to part, because then all of a sudden you're going to wake up at 3 a.m. in the morning because your mouth is parched. You're going to want to drink some water. By that time, your oral microbiome has greatly been impacted. So, you know, but mouth taping has other benefits. I mean, it helps helps lower your respiratory rate. Breathing through your nose is the best way to breathe, unless you need to emergency breathe, like panic breathing or exercise breathing, and that would be through your mouth. But typically we need to breathe through our nose. It prevents us from overbreathing CO2. It helps. I mean, the yogis were right. That mix of CO2 and O2, CO2 is not a toxin. Too much of it will kill us, of course, but that can be said about many things. Too much nitrous oxide can kill us, right? It's really the lack of oxygen that kills us. But that mix of CO2 and O2 is very important. And nose breathing allows us to mix it perfectly without even thinking about what we need to do. We don't even need to worry about a respiratory rate or box breathing. Or if you can breathe through your nose at rest, you're doing 90% of it correctly. And it's a no-brainer.
How do you know when the snoring of your kid is too much?
It's a great question. Well, snoring in itself, I would recommend seeing a ENT, pediatric ENT, but someone that has that education or sees it for what it is. Just going to an ENT doesn't mean you're going to get the right information. A lot of ENTs will tell you that child will grow out of it. And that's the worst information you can give to that child, to that parent. I think one of the easy paths, ironically, is through a dentist, not right to the physician, the primary care physician, because they typically don't have the training. There's an organization where I learned all my sleep medicine training, sleep dental medicine training, and that's the AADSM, the American Academy of Dental Sleep Medicine. I'll give you the link, aadsm.org. They have a directory. I direct people. I get this question a lot on Instagram. I direct them to aadsm.org. glad you caught the snoring, glad you had the foresight to reach out to me or to think that it was important because it's not cute. It may sound cute, right? But and then that dentist is trained and they will have a referral network of people that have that training, like that pediatric ENT. And from there, you'll get the right information.
I want to rewind for a moment and talk about the difference between, what most people think of when they go to the dentist and functional dentistry. So can you explain the difference for people who are listening?
So dentistry is one of the great professions. In the US, we've got great training, but it's a very clinically based, reactive kind of profession, just like medicine. So you categorize and triage the symptoms, you come up with a diagnosis, hopefully it's the correct one, and then you treat all those symptoms and you look for resolution of that. And that includes medication. And so we all know that model. And I think that model for chronic disease is very flawed. But for example, if the analogy in dentistry, I mean, if you get in a car accident, medicine can piece you back together. In dentistry, it's the same thing. We have a lot of car accident victims, teeth are knocked out, broken jaws, and we're great at putting all that together. That is a great application of that kind of dentistry. But then there's this functional medicine, which most of us have heard about it, and it applies to dentistry. And again, we are practicing alongside each other. The physician knows very little bit about the mouth, and the dentist knows very little about the overall body. It should be the same. And there are some practicalities and concerns, but it could be done. But anyway, so the functional approach in dentistry, as you would expect, just like in medicine, is kind of working upstream. It's working and being very active as the practitioner in the prodromal part of disease. In other words, before symptoms, checking for wellness, and then if you catch something like testing for the oral microbiome is a perfect example. There are no symptoms, patient's healthy, no bleeding gums when they brush and floss. Get an oral microbiome test. See if the P. gingivalis bug is taking hold. That's the bug that causes gum disease and later gets past the blood-brain barrier and is one of the causative factors of Alzheimer's. I mean, why not know that information just by spitting into a little tube and sending that off every year? Again, insurance should be covering this. More on that later if you want to go there. But anyway, so that's the functional dentist, and they are looking not just at treating symptoms. They're skilled clinicians. They can do anything that a regular dentist does. They can place implants, do crowns. Teeth break. You are going to fall, and a tooth will break, and you will need to have that addressed. But what if gum disease, which is where we spend most of our time, and fixing cavities, that can all be prevented. And that's what a functional provider does. He or she teaches and prevents and thinks that way. In other words, while they are fixing the cavity, the intent there and the discussion during or after, whenever, is how can we prevent this from happening again? And why did it happen to begin with?
And so why do you think that is?
The example I gave was because of a dysbiosis of the oral microbiome. That's where most oral disease comes from. And then why does the oral microbiome go awry? It's that pole position where the mouth is open. It is so exposed to the outside elements. One night of mouth breathing, actually a few hours of mouth breathing at night, will alter the pH. The pH will drop to about, there's studies, in kids it's 6.2, it can go lower than that. The biome can't take that. I mean, if that was the gut microbiome, it would not be able to do what it's supposed to do. So pH changes are rather sudden and happen very often in the mouth.
So what have you seen with COVID in the last few years and the oral microbiome?
That's a very good question. We saw a lot of things in COVID. A lot of people did not go see the dentist, which of course, these are the ones that needed to go, and oral cancer is on the rise. Variety of reasons there. More drinking. Per capita consumption of alcohol went up, and I understand that. I mean, people were home. People were watching TV. They were more sedentary. The lymph tissue was not being pumped by activity and motion. And so there's that. I mean, again, COVID affected every part of the body, every aspect of our health. Why would the mouth be immune? There are so many things. Gum disease got worse. Cavity rate, haven't read much about that. Probably among children, they were home more often. I think one of the big issues was childcare in COVID. So if they weren't at school, the parents can't afford childcare. They were still working online. What are the kids doing? They're watching TV, eating goldfish. School, they were running around, right?
I also want to go back to one of the things you were talking about with doctors and dentists and the oral microbiome, and how we do in the West really categorize and have different specialties. And so nobody is looking at things as a whole. And that's really what I love about the message you are sending to people, is how that oral microbiome is connected to your gut, it's connected to your brain, and how important that message is for people to understand. I want to dive a little bit deeper into the relationship with Alzheimer's. So can you give us a little more specificity about what people can look for, what people can do, and what changes they can make?
Right. So what you said earlier is so true, but thinking and talking that way, in that functional way, allows the dentist to see the rest of the body. They cannot not think about the rest of the body if they think that way. And every provider should do that. It should, even a podiatrist. The person I see for my eyes, she has that kind of global view. I mean, that's a great place to check for early diabetes, because the blood vessels are so small in the back of the eye, just like they are in the gums and the kidneys and the peripheral blood supply. So to answer your question about Alzheimer's, so I mean, there are a lot of connections. The big exciting one in dentistry, because it gets a lot of attention, of course, is that there is a bug that is associated with gum disease. I mentioned it before, the P. gingivalis, which is in your mouth and in my mouth. It's always there. All these bugs are always there. The H. pylori bug, which is responsible for ulcers, it's in the mouth. There's a connection to the gut. It's there. If it becomes prevalent in the mouth, it can cause an ulcer in the stomach, because the two biomes are connected, obviously, via saliva, most likely, but there are probably other connections. But this P. gingivalis bug, when it becomes prominent for a variety of reasons, and the other bugs that help modulate that bug are not doing well, either they've been taken out by oral care products like mouthwash, that disinfection thinking in the mouth, or you've been feeding the bugs with sugars, that fermentation kind of concept. It's almost like cancer. I mean, cancer is a disease of fermentation. Those cancer cells have found their own energy supply, right? It's almost like the bugs kind of see this food that evolutionarily was not there before. Again, we've created these flours and refined cereals and breads, and they become very dominant, and then they cause an infection or a superinfection in the mouth. The body responds to that, the mouth responds to that, and the immune system has all sorts of arms and tentacles and things to do in the mouth, and it really becomes an overreaction, essentially where the gums necrose away. You get recession and they melt away. And again, it's that small blood supply. If you get chronic inflammation in the blood supply and the gums bleed, if you're bleeding and you see that in the sink when you're spitting out after brushing, that means your gums are shrinking and that blood supply is continually overactive. In other words, and those blood vessels are breaking down, and that's why the tissue necrosis happens in liver disease. It happens in the back of the eye. These blood vessels cannot take long-term high blood pressure. Ironically, mouthwash elevates our blood pressure. That's an oral care product that in turn damages these blood vessels in the gums. But anyway, so the P. gingivalis bug takes hold. The immune system responds. The gums bleed. They become very inflamed. They're responding to this invasion. These P. gingivalis bugs can get past that little girdle of connective tissue that I mentioned earlier. We call it the biological width. That's that unique part of the body where you don't see anywhere else, where the body is trying to control entry and exit of things, mostly entry of bugs, past this feeding tube. That's the analogy. It's the only analogy I can think of. And it could be a PICC line. It could be many things. All those things are very dangerous in medicine. And typically you're on antibiotics while you have that line in you. It's the only way to control the infection. Well, the body's doing this. It's preventing that. But that tissue breaks down at that biological width. The fibers break down. Collagen breaks down. The bugs get into the body. They can get in via 3 mechanisms. There are perhaps more, but the ones that we know about are it's via inflammation, injury. But essentially, the bug can get in itself and get into the blood supply. That's called a bacteremia. And then it will go through the blood, and when it gets to the brain, it'll get past the blood-brain barrier, especially if you're older, if you're on meds, smoking pot, THC, probably alcohol. I can't confirm that. But there are different states of permeability of that blood-brain barrier. But anyway, when the brain sees that bug, which is an oral bug, it produces a substance called the gingipane. It's a protease, and that tells the brain to protect itself, and it lays down amyloid plaque. In the old days, we used to think was the cause of Alzheimer's. It turns out it's an indication that you are experiencing or will get Alzheimer's. So oral bugs get everywhere. They get into the heart, they can get into the pancreas, they can get into the kidneys. This is a very common thing. And then there's an indirect effect, and that's the injury and inflammation. There's infection, injury, and inflammation. Those are the three. So infection is the example I gave you. It's a direct infection of the bug getting to that area via the blood supply.
Now, what about HPV? What about, well, I want to talk about oral cancer. I also want to talk about what happens in the mouth during oral cancer, during the HPV virus, and herpes.
So HPV-1 on the rise, although this vaccination that teenagers are getting, however you feel about vaccinating, I don't know enough about the science. There may be a reason why they do it then. I think the real reason is they think that a 9-year-old is going to be sexually active, and then they pick on girls first. So I don't know if that's a good policy or not. But if you're going to, it's a bug that can get into the brain. It can cause a lot of problems. It's a virus, and it is present in the mouth quite often. And most of us have it, but the immune system is able to suppress it, and so is your oral microbiome. But the minute you become sick for some other reason, and that immune system in the mouth is under attack and it's not doing well, or it's expending a lot of energy dealing with some other infection, or it's suppressed in some way, could be as simple as pH change in the saliva, then those kind of diseases are going to express themselves. And the dangerous one, of course, is tongue cancer. And that is on the rise. And it used to be, in the old days, 20, 30 years ago, it was all based on tobacco and alcohol use. Now it's the infection of the herpes virus. And so we have a post on this. It's an old post. It's probably 15 years old already. There was a Harvard study that I found, and based on that, I asked, we have a lot of practitioners that follow our site as well, but certainly anyone that reads it needs to know if you have over 20 sexual partners by a certain age, you are more prone to getting tongue cancer than if you have under 20. And that's something that should be on your dental form when you're filling out the dental form. And I think the title of the blog post was, should you have a discussion with your dentist about your sexual practices? And of course the answer is yes. So that's all kind of been changing. Your question about COVID, that's on the rise as well. A lot of people are home.
Wait, before we get into COVID, I want to spend a minute on being sexually active and herpes and HPV, because I do think about that sometimes with oral sex. It's enjoyable.
But it can transmit that herpes bug. Absolutely.
And HPV as well.
Absolutely.
So but if you're just with one partner at some point, are you less prone to it, or it could be dormant and then rise? What are your,
It's just it's odds. It's the more partners you're with, the more likely you're going to come across it. And that's what that study from Harvard, I think it was 40 partners or 20, I can't remember. But
okay, but if you had 20 and now you're with one.
Well, and you don't have it, you should be fine. Yes.
So I'm not saying refrain from oral sex.
Right. Oh, I am. I mean, if you want to be safe.
You do
if you
say that.
Well, if you have the same partner, let's say you have the same partner, you've had the same partner for 20 years, and one of those partners has the virus, you have to practice oral sex in a certain way. I mean, rubber dams, and it's that is in the literature.
I know, it's not hot. It's not hot, people.
Definitely not.
I did want to address that. And so, cancer of the tongue, throat cancer coming from HPV.
And if it's caught early, the chances of surviving it are quite high. I think it's over 90%, and that's good news. But here's the bad news is your dentist who does that oral cancer check, or your hygienist, they can't see the parts of the tongue that typically show it first. And I would be very frank about this with my patients, and I would ask them symptoms like difficulty swallowing, airway issues. I mean, the back of the tongue will swallow. Do you feel like you've got something there and you keep wanting to swallow? Persistent coughs. That was always talked about and discussed. And first visit, we would always say, listen, if that ever happens, I want to be the first person to know about it. And then we sent it out to, I had an ENT that I worked with who was wonderful. He would see those patients right away because the patient's concerned at this point. There was no waiting period. This was in Sunnyvale, California, in the Silicon Valley, and nasal endoscopy, very simple procedure, and those are the people that can see it. So if you aren't seeing a physician, you're not thinking about what are the symptoms of tongue cancer, you have the virus, HPV virus, where you think you have it, and I mean, don't rely on your dentist and the oral cancer exams. We'll catch it late. That's the key to survivability, is catching it early. So it's a tricky thing. That was a controversial post, of course.
All right. I want to get some basics for people. I want to talk about water quality, toothpaste, and get back to that mouthwash. So first, mouthwash. Even if you have a pH, a low pH or pH balanced mouthwash, still no. Or are there some, or you make your own mouthwash? What do you think?
Okay, you can make your own mouthwash. There are no essential oils in it, those are bactericidal. On the weekend, no alcohol, no peroxidases, hydrogen peroxide, enzymes, cetylperidine. It's a pesticide. Crest has it. Crest Oral Health has it. I mean, triclosan used to be in it. Detergent, again, pesticide based. Chlorhexidine is the big one. I think that's now over the counter. That's something that dentists used to use after gum surgery. It would stain your teeth, but it was like a liquid brush is what we called it. It was brushing, which we didn't want you to do after surgery, but it was a liquid form of it. It was very cytotoxic. It would just kill everything in the mouth and try and manage things that way for 2 or 3 weeks. So all of these mouthwashes affect a niche, an oral microbiome niche. There are all these different niches, and they're all slightly different from each other. And one of the niches is on the base of the tongue. And these are bacteria that can take a nitrate and convert it into nitrite and then into nitric oxide. And nitric oxide is this wonderful gas, very transient, short-lived, probably now an indicator of aging based on how much you're able to produce. That gas lowers your blood pressure. So if you are always killing and knocking down or carpet bombing, whatever term you want to use, the oral microbiome, then these bugs will have trouble producing that gas, and then your blood pressure actually goes up. Conversely to that, there's a new study out, just 6-8 weeks old, that tongue scraping, again, they're assuming you're not using mouthwash, but tongue scraping in that area can actually lower your blood pressure. And that's because you're allowing those NO-producing bugs to thrive. And so you're producing more nitric oxide. So mouthwash, back to your question. Let's say you had a very innocuous mouthwash. There's some that are out there. You're basically swishing with water or salt water. That still doesn't do anything. It's still the mechanics or the mechanical action of flossing and brushing. And that is about 80% of the equation. Maybe toothpaste a little bit. We can talk about that. But mouthwash, you're swishing with. I would rather have you use a water pick.
So talk to us about toothpaste.
Toothpaste. So there really isn't a toothpaste out there that I'm happy with. I make recommendations, but they still have surfactants and emulsifiers in them. That these are ingredients that are there not for your oral microbiome necessarily. They're not even being put there on purpose, which is what the industry likes to do, to disinfect your mouth. They are just there to help manufacture large batches of toothpaste in a homogeneous form so that when they fill the tubes, I've been to toothpaste factories, it's hilarious. And when they fill the tubes, you want each tube to have the same consistency. It's very difficult to make toothpaste and natural toothpaste, but if you put emulsifiers and surfactants in there, then every time you squeeze the tube and then the tube releases a little bit, there's a little bit of an air pocket. It prevents it from spoiling, it keeps the mix, it prevents it from coming out of solution, and it prevents those little squirts of clear liquid. That's why they put it in there. This is a totally man-made product that we now use because of our diet. So we created one problem, so then we create another problem. And these toothpastes are not oral microbiome friendly. There are some better toothpastes than others. I make recommendations on the website. I've heard that there is a toothpaste. I've been told that there is a toothpaste coming out that Dr. B will like. So I'm looking forward to that. It'll have hydroxyapatite in it. It'll have a certain form of it. It may have other things in it. I don't want to discuss that because I know someone who's working on this. And then it will not have these emulsifiers and surfactants in it. So most basic toothpaste that you buy, or at CVS and Safeway, wherever, Amazon, can't forget about Amazon, right? These products really don't get it. They're based on an old model around World War I. Disinfect the mouth. Be abrasive. Take down the biofilm while using a brush. Make sure that the person brushing feels that very slippery, clean feeling, not that slimy feeling of the biofilm. They essentially built it based on that model. They had a psychologist try and figure out how to make this appealing to people that have never seen toothpaste before. And these were our GIs in World War I who couldn't fight on the front line because they had terrible teeth because we had invented breakfast cereal, Captain Crunch, whatever. So anyway, toothpaste is an important part of the equation, but it is not the most important part. But
so what do you use and your kids use?
So I use a formulation that I've made on my own. I do use Boca. I like Boca because of the nanohydroxyapatite. That was one of the first. That may have been the first toothpaste in the U.S. Again, this biomimetic material that is in our teeth right now, not in the nano form, in a more natural form, non-manufactured form. That is what our enamel's made up of. That's what half of our dentin is made up of, is hydroxyapatite. It's a hydrogen ion with calcium, a little phosphorus in there, combined with collagen. If it's enamel, there's no collagen. That's what our teeth are made up of. It's the hardest substance in the body. It's that inanimate object poking out through our body. And we need teeth. We need teeth. It's the beginning of digestion. There are a lot of functions to teeth, certainly, but so that is now in toothpaste in America, but you have to buy it from a boutique brand. Crest, you won't find it in Crest or Colgate or, all these other big brands. And of course, they have lots of surfactants, and sodium lauryl sulfate is the big surfactant. They're just making these in large batches. The toothpaste industry is a very lucrative one. It's incredible. And they're not going to change their model until they see some change in what people purchase.
Right. Well, that's like what I talk about with deodorant. I don't want people putting these chemicals directly into their axillary lymph nodes in the armpit. I'm like, just don't do it. You don't need it. Like, everyone's like, can I find a healthy one? And I'm like, just don't. Why? You don't need, you're going to smell less too if you eat clean.
Well, totally. Absolutely. And if your biome, there's a biome here. I mean, if that is healthy, you're going to be fine. You don't need all these. Again, it's like toothpaste. We invented toothpaste because we screwed everything else up.
Right. Now, what about our water supply and the fluoride in our water supply?
Yeah, that's a big concern for me. I have 3 daughters. I raised them without fluoridated water. Back then, I didn't have a lot of data on it, but to me, it just didn't seem right.
So, so many people don't have access to great clean water in the United States. So what do you recommend? Installing a whole water system can be so expensive. It can be very prohibitive to put it in the whole house. So what do you recommend to new parents or kids or people who are, want to do the right thing for their family?
Yeah, great question. So let's say you're a renter. You're not going to install a reverse osmosis system. That's, you could probably take some of that with you. You could buy a commercial grade distillation unit or distill your water that you could take with you, but the plumbing that goes to the sink, that stays with the house. So, and we've written about this a lot on our website. We make recommendations. We've got a store on what to buy, and there are countertop filters, and I love mine. I have distilled water delivered, then I add minerals. Up in Tahoe, we do drink the tap water, but we filter through this tabletop filter. It's made in Southern California. And the first thing I look for in a filter is, does it remove fluoride? That's important. Even though I'm an old guy, the brain could be developing. You never know. So I want to give it every chance possible. But the grandkids will come up there, and I want to make sure that they're not exposed to fluoride, which they haven't been, just like my daughters. And again, they don't have cavities. There's really no connection between fluoride in the water and how many cavities you're going to end up with. It's really about food and environment and dry mouth and so many other factors. But anyway, that's not what the industry wants you to know. So those countertop filters are great. They're a little on the pricey side, but you can order one from Amazon, have it there the next day, and your family is safe. The filters last for 3 to 5 months. If you have another filter in the house that doesn't filter fluoride, filter that way first, pick up that water, put it in that way your filter in the clearly filtered countertop will last longer because they're filtering out other, there's pre-filtrate that needs to be done on even with tap water, and then you'll have clean water. The third thing I look for, microplastics. A lot of these filters put microplastics into the drinking water. They have plastic beads in the resin matrix of the filter. So there's only one filter that I feel comfortable with right now. But it's available. It's cheap. It's inexpensive.
Right. Okay. So earlier in this conversation, we started talking about the different things that you recommend for your patients, like turmeric. You shared a 2014 clinical trial on your Instagram that found curcumin, the active ingredient turmeric, that effectively targets gingivitis by reducing inflammation. You have other essential tips like D3, K2, vitamin A, calcium, prebiotics, trace minerals. So can you give us, a little holistic resource toolbox? And everyone's going to go to your website, but just if they're listening, they're taking a walk, some supplements or things that they should be doing.
Right. So the question is do you need supplements? And my answer is, and I've been taking supplements my whole life, but you can take too many, certainly. And then there's the quality of the supplement. It certainly can be a costly thing as well. But here's my reasoning on this is, and I know this in dentistry, and I know that my patients that are on supplements, especially the ones that I recommend, do much better. They do much better overall in terms of preventing disease, oral disease, but they also do better after gum surgery or after I place an implant, or even sometimes with sleep. There's supplements I recommend for sleep. A lot of my patients I treat with mandibular advancement devices and refer out to sleep medical experts, and then we go back and forth. And so supplements are necessary. It's overwhelming for the layperson. Actually, another dentist and I, Dr. Stacy and I, are presenting a course. It's a 5.5-hour course on resetting your oral microbiome, and one of the modules is on supplements. That's how important we see that as a, and it'll be on our website in a few weeks or maybe in a month. But in any case, so there are resources to fall back on. We do have some blog posts, certainly. There's a masterclass on Dr. Mark Hyman on supplements that I did. So reach out to me if you want. It is very confusing. I understand that. And of course, I can't give you specific advice because I would have to know what your condition is, weight, gender, all these age, systemic conditions and all that. But in general, there are some must-haves. They are, and I'll just go through the list: K2, D3, and A, and some magnesium. Those four are so important in dentistry. You've got to get calcium. You have to get minerals. Just buy a bottle of those trace element minerals from the Great Salt Lake. Again, we have it on our store. You can get it on Amazon. That little bottle for $10 will last you a year, your family for a year. You put a little bit of that in your water. You're getting boron, for example, and phosphorus and calcium carbonate into your saliva. The saliva needs that for many reasons. Of course, we need minerals for every cellular process. I think there are over 500 of them. We need those minerals, especially calcium. But we also need the presence of these minerals in our saliva because when the tooth is trying to fix itself via remineralization, that remineralization, demineralization kind of equilibrium, which is always going on in our mouth, it's looking for a source for these minerals. It's in your saliva. In bone, it would be, it's finding it in the blood, essentially. If the calcium metabolism is shifting to where you're laying down bone or kneading bone, the blood is pulling calcium from the bone. So there's no blood supply that is available to the teeth on the outside. To rebuild those surfaces, it's looking to saliva. Again, another fluid in the body, like lymph, that has multiple reasons to exist, right? So what else? K2 is very important. I call that the dental vitamin. It's not K1. Again, there are several versions of it. We talk about which versions to take, both essentially. But it activates proteins that help take calcium. Once it passes the gut barrier and gets into the blood supply, what's all that calcium doing in your blood supply if it's not being used? K2 is the great enabler. It is the facilitator. And it pulls the calcium into all the right places, including your teeth and bones, alveolar bone, bone around the teeth. So that's important as well. And then D3 and A, of course, help with that whole process. There's CoQ10. CoQ10 is a big gum disease. Little variability there on results in the studies, but I definitely recommend that for patients that have gum disease.
It's so interesting because in a lot of these interviews I've done for It's Your Lymph podcast, I ask a lot of these questions of the various practitioners, and these are like the big ones. These supplements will help a lot of chronic inflammation and body across the board. So Those are just so great. So I want to do a little rapid fire, some thoughts, questions for you on certain things. Tonsils and adenoids removal in kids.
Yes, consider it.
Yeah. Okay.
So in my day, I mean, I remember as a kid, I don't know why I remember this. This is pre-dental education, of course. My dad was a physician. This was San Francisco Children's Hospital. I remember being seen for big tonsils. Again, I was 5, 6 years, 7 years old. I don't remember all the details, but and then I remember hearing the doctor speaking to my mom saying, we don't take tonsils out anymore. Where before that, I was on the cusp of that generation that didn't have that done. And then, but before that, everyone, it was like wisdom teeth. Everyone had their tonsils.
Exactly.
Right. So I just remember feeling that relief, like, oh, this is great. I was born at the right time. Who would have thought to remember that? But anyway, but of course now the techniques have gotten better. I think that was really more a decision of convenience because it was difficult back then and the risk was high to take out tonsils. But now it's much simpler. Anesthesia is much safer. And also the reasons back then were different than they are now, and that is that it constricts the airway. And if the child can't breathe through their nose, then their face is going to develop in such a way that they are prone to a life of sleep disorder breathing, which of course means heart disease, cancer, brain fog, neurological diseases, all the comorbidities. There are more. So consider it.
I'm so glad you said that. I have a client who's, her daughter cannot breathe through her nose.
How long do you want to wait till they outgrow that? And what does outgrowing mean? What is the definition of that? Right. So,
and, I get people who ask me about it because, tonsils are lymphoid tissue, and I always tell people that those lymphoid organs and the spleen and the appendix, they're in high bacterial areas where there's a lot of bacterial traffic. And so it's important. But if you have it removed, even more reason to do lymphatic drainage, even more reason to keep moving that area that might have a hard time getting moved on its own.
That you bring up an interesting point. I didn't give you the full breadth of it. I don't like removing any part of the body, right? I mean, even the appendix, right? Unless you absolutely have to. But for example, gallbladder, perfect example, right? But however, so before that decision is made, and again, I would refer you to a dentist before I refer you to a physician for TNA, for tonsils and adenoids, just for working it all out. A well-trained functional dentist will address mouth breathing. If mouth breathing is an issue, which it typically is, that is feeding the tonsils. It's drying them out, it's making them very inflamed, and it's going to make them swell, and the adenoids. So maybe 6 months of mouth taping and oral microbiome therapy, et cetera, and dietary change before that decision is made.
Now, what about mouth guards?
Gosh, if your kid is out there wrestling or football, absolutely. But for wearing it at night or for bruxism and grinding, and absolutely no. I mean,
right, that's how I feel. Thank you. Tell us why.
Well, there are plenty of studies out there, plenty now. There weren't back in the early days when I was working, practicing, but I always knew, and I made a lot of mouth guards in my career, in my years, but I always knew that I wasn't treating the root cause. It was a protected device. It's like if you have a person that keeps bumping their head up against the wall, you're going to put a piece of plastic there, right? I mean, with a cushion. And we're done, right? Well, I mean, the etiology now for grinding has changed, and so much so that we've changed the name. It's called sleep bruxism. It's related to a small airway. It's a complicated kind of etiology, but because that has changed and our way of thinking has changed, it turns out, according to the studies, that making the night guard can actually make bruxism worse because positioning your jaw in such a way that it's making the airway smaller. Not only are you not fixing the root cause and applying a Band-Aid, you're actually making things worse. So be very careful. Make sure you're seeing an enlightened dentist on that. In some cases, bad bite, poor positioning of the jaw joint. I would say a night guard, a hard, well-made, aligned night guard for those kind of conditions temporarily to reset the jaw, to reset the bite and all that is a good thing. But this thing of just making night guards for people that grind for the rest of their life, you're not addressing the root cause.
It seems like a petri dish of like bacteria that you keep putting in your mouth every single night.
And plastics too. And remember, you're grinding down those plastics, you're breaking them up, you're ingesting PVA, polyvinyl. I mean, right. Yeah.
Well, then what about Invisalign?
Invisalign is more flexible. It doesn't really break apart as much. It's a short-term period of therapy. Um, it is medical grade. It's not perfect, but then braces aren't either. I mean, you could do stainless steel brackets, but they're glued on with a composite that has BPA in it. I mean, it just, I mean, it's like pick your poison. But on the other hand, if you don't get the proper width of the jaw, then your airway behind it and the nasal passages above it won't have the breadth and lumen space and volume that's needed for proper breathing. So,
So, right. So we're like risk benefit here, like kids and braces and retainers.
right, same thing. Retainers are, that acrylic has a monomer in it and it degasses over a long period of time. So, yeah, I mean,
I used to beg my when I was younger, I used to beg my dentist for a retainer because I thought they were cool.
well, that's how they're sold. You can get decals, you can customize them. It's brilliant.
I mean, my kid does not want his retainer. He never wears it. And I'm like, yeah, you don't need it. But they were like, no, you have worse problems. You don't need braces or retainer. It's more like the inside of things. Now, what about TMJ?
TMJ, usually a history of trauma, falling, getting hit, accidents, violence, unfortunately. It's a complicated triad of many symptoms. A lot of them are behavioral. This is a very complicated joint. We're able to dislocate it, translocate it is the term we use. You can't do that with any of your other joints. You'd have to go see someone to have it popped back in. It's two joints that allow a U-shaped jaw with teeth in it to do circular motions under duress, 200 to 300 pounds per square inch of force with the opposing jaw, which is the base of the skull. This little disc has to travel with that translocation, that movement and that circular motion. A lot can go wrong with it. And a lot can go wrong with it based on how we develop, how our face develops. So if you have early airway issues, you could have TMJ issues, you could be bruxing a lot. It's a very complicated thing. And unfortunately, most dentists don't see the full picture. You'd really have to go see a specialist.
And what about people who are thinking about removing root canals, removing cavities, removing crowns, opening the Pandora's box there? What do you think about that?
Well, root canal has its own category, real shock factor there. So a properly done root canal is viable. The question is what is a properly done root canal? And I can get into that if you want, but a lot of root canals will fail. And the bad news that we always hear about with root canals, how they can take down other organs and put bacteria in the blood. There are a lot of things that can do that, including a root canal. A root canal that is infected or has allowed bacteria to recolonize, of course, can do that. And does that have to be removed? Probably. Retreating a root canal is a 50-50 proposition. A properly done root canal can be a tooth that you can maintain properly. You'd have to check it. You'd have to get three-dimensional images every 2 to 5 years to make sure it doesn't fail. But that can exist in your body. A lot of people like, how can an inanimate object in the body exist? Well, that's kind of what the teeth are doing right now. Yes, they do have a blood supply in them, but at the outside of the tooth still has ligaments that are bonding with the tooth. It's moving in the socket. It's a complicated subject. It's very heated. There are a group of dentists, very small group of dentists, that basically are online on Instagram telling you to take out all your root canal teeth immediately. And then what do? Well, then you put an implant in. An implant has its issues too. That biological width that I was talking about, that crucial area that prevents bacteria from getting into places where they shouldn't in the body, like the brain, that doesn't exist with an implant. How do you maintain that? How do you clean it? A lot of people are sensitive to titanium currently. It's not as clean as we used to think. We've got zirconia now. Zirconia has some issues. So it's always better to keep your own tooth if possible. People that have fewer teeth than what they were born with live shorter lives. We've got plenty of data that supports that. So it's a tricky situation. Fillings, I mean, try and prevent that from happening. If you need a filling, get it filled before it turns into a root canal, before it turns into a crown, before you need more materials and more time in the dental chair. And remember, when the dentist is adjusting that crown, that all porcelain crown, most of them are zirconia now, and he's adjusting it to make it fit properly, hopefully he's wearing a mask. I would volunteer that the patient should wear a mask and the assistant should wear a mask, typically they are, because you're breathing in zirconia particles while that's being adjusted. incidence of lung disease because of these zirconia crowns, because we're always adjusting them. So make sure your dentist has a good lab where he pops the crowns in. About, I would say 98% of my crowns would go straight in with no adjustment. And if I had to adjust a little bit more than 5 minutes, boom, they'd go back to the lab. I wouldn't care. Patient would be disappointed, but then I would say, listen, if we grind it a lot, we're breathing in zirconia particles. They'd be like, no problem, I'll be back.
Right.
I'm going to be back.
All right, I want to take us full circle on this journey. When we started this conversation, you were talking about how you did some research about lymph for this episode. And I've spoken to a bunch of doctors over the course of 30 years that I've been studying the lymphatic system, and so many of them do tell me they get 15 pages of their textbook on lymph. And I'm curious, and also there haven't been a ton of studies on lymph drainage, but there has been studies on the efficacy of manual lymphatic drainage after dental surgery. And there has been a study that has shown how manual lymphatic drainage can reduce inflammation after dental surgery. And I'm just wondering what else you have found in the literature with lymph and teeth and dentistry.
Well, you're right. There isn't a lot of information, especially the dental curriculum. I mentioned early on in this episode on how the one mentioned was the sternomastoid chain of lymph tissue here. And, when we palpate that and we feel bumps, we know that there's an infection. Again, it could be a dental infection. So dental school was not very good for that. There is very little information out there. I dug pretty deep, and there was only really two studies that really got me excited. And one, it was from Japan in 2002. And I will give you the link to this, but it was fascinating. But it turns out that, again, I'm not a lymph expert, but I wasn't surprised by this, and it shouldn't surprise anyone, but 1/3 of the lymph system in totality is in the head and neck. I mean,
there's so much. The submental and and the mandibular lymph nodes, yes. I mean, they're even saying that the deep cervical lymph nodes, doing some of that lymphatic massage has shown to reduce brain inflammation.
I believe that.
Right? So we're on sort of the cusp of so much more information coming out about lymphatic health. So I always teach people and tell people how to do lymphatic self-massage. But yes, again, like you're talking about with the oral microbiome, we have so much bacteria. So of course there's so much lymph tissue and lymph nodes in the head and neck.
But the good news is that there is lymph tissue, and I think this will blow most dentists' minds. There is lymph tissue inside the tooth. There's tissue there. The thing I liked about this study was the degree of specificity in terms of they were all electron micrographs of cross sections longitudinally of teeth, of gum tissue. As dentists, we're used to seeing diagrams. The tooth is here. You've got the tissue coming up. There's the free margin up here. There's that little pocket here. The tooth extends above it. You have all these little fibers here. But to see it on a scanning electron microscope image with the location of lymph tissue pointed out was absolutely mind-blowing. And
so cool.
It is. And in dentistry, we're big on the spread of infection in the fascial spaces. There's that submental and sublingual space. And a good dentist will know based on where the swelling is, if it's here or here, can just from that information know which tooth is infected. It's not very easy sometimes to know which tooth is causing the infection. We tap on the teeth, we test them for heat and cold, and we look at x-rays, but a lot of the time it's not clear which tooth is the one causing the infection. So by looking at where the infection is going in these in the fascial spaces, you can tell a lot. But that's not what we're talking about. We're talking about another space, and that's this lymphatic network. And again, dentistry gets nothing on that. I wonder if physicians even get anything on it. But here's what this study found, the one with all the pictures. I love studies with lots of pictures. Where the lymph was, where the presence of lymph and lymph tissue was. And they show it in many different ways. They inject markers so they can tell how quickly the lymph tissue, the lymph fluid, the lymph they call it, where it travels and how quickly it travels. So in the gums, it's mostly in the cervical area. In other words, up near the gum line. Again, that's that crucial area that I keep talking about. So I'm not surprised by that. And there's very little of it down near the apice, near the tip of the root. It's also in the pulp tissue. Pulp tissue we talk about all the time. That's the mesenchymal tissue that created the enamel organ. And from that, the tooth grows outwards, first dentin, then cementum, and then that enamel layer. That's what grows the tooth. And that has a blood supply to it. It has a nervous supply to it. When it dies, that's when you need a root canal because that becomes infected. Again, a very unique part of the body where you have tissue inside of a closed space. I guess the brain would be the only other place, but that's much larger and a little bit different. But when tissue swells, it needs room to swell. You don't get that in the tooth, and that in itself can cut off its own blood supply, and then the tooth tissue dies. So, but in pulp tissue, there is lymph tissue, and the images are beautiful. It's, I mean, I'm used to seeing blood supplies and the neuronal sheath, and then the mesenchymal tissue, and then the outer layer of dentin. But then these images are made in such a way where all you see is the lymph tissue, and it's beautiful. It's absolutely beautiful. It's in the tooth and the pulp. And the lymph lines or channels are kind of correspond with the length of the tooth, and there is lymph flow that goes out the tip of the root of the tooth. There is some talk about lymph flow out through the dentinal tubules. I have not seen any good substantiation of that. Could be the case. There is fluid in those tubules. I'm not sure it's lymph, and this study does not indicate that, and they did a very good job of identifying the presence of lymph tissue in all anatomical parts of the mouth, including teeth. So there was no sign of that, and that doesn't surprise me. The lymph tissue is more up against the outside layer of the pulp where the adenoblast are. These are the little cells that create, new dentin. I mean, we're laying down dentin. We're building tooth structure on the inside of our teeth, even as adults. That process doesn't stop. It just slows down. And then there's less lymph tissue towards the inside, but that's where all the blood vessels are. But there are channels and layers that go out the tip of the root. So, I mean, to me, that's fascinating. What would I do with that information? I don't know. I mean, it's so new. I mean, is it part of the equation? Absolutely. Can a tooth die because of poor lymph drainage? Absolutely. I do have some theories, though. One is that the motion and action of toothbrushing, which we think is scraping away biofilm, I think the most important aspect of that is massaging the gums, because that is expressing lymph in the gums and out.
I mean, I could just tear up actually with
Yeah, I mean, to me, it makes sense. Massaging the gums. I've been saying it for years, but I don't know why I was saying it. This study explains it.
Oh, you're welcome.
You're squeezing and massaging and pushing out, expressing, or speeding up the process of lymph drainage.
Yes. So, and would you recommend that, some dentists will give you this little tool that has the little rubber tip, but then that's rubber, or did you say just get some cheesecloth and use your finger, or does it not matter?
Doesn't matter. I mean, most of it can come just from taking I use a very wide head, very small but wide head, because I don't want to just brush the teeth or where the teeth meet the gums. I want to brush the gums, which is where all the free margin, the cervical area, which I referred to earlier, that's where the lymph tissue is in the gums. It dissipates as you get further up, so you don't have to massage that area. But the tissue, the flap of tissue that has both sides, because there's a pocket on the other side up against the tooth, that tissue is very thin and very narrow. By definition, then it has a very fragile blood supply. It has lymph tissue in it. Why not start massaging and brushing that?
I'm going to see your blog post on that coming soon. I wrote a book. I'll send you a copy. It's called The Book of Lymph. And in it is a bunch of self-care lymphatic self-massage sequences for headaches, earaches, breast, digestion, inflammation, menstruation, cancer, after cancer surgery, to reduce inflammation and to drain the lymph fluid towards their regional lymph nodes. So that's my whole world. And I'm always recommending massaging lymph fluid on the outside of the face. I know there's people who do that, inner mouth, but I have also seen, though, too aggressive inner mouth work can bring up canker sores, can bring up herpes sores. Actually, sometimes it's so aggressive, I don't always recommend that. But also, still with lymph massage, it's because I love how you talked about how beautiful that imagery was that you saw. And that's what I want people to see, is how beautiful lymph flow, the lymph vessels, like the roots of a tree, the absorption and the transportation. But the lymph massage is very gentle. It's so superficial. It doesn't take much. So when people are going into the mouth so aggressive, it's overstimulating for the nervous system, and it can be overstimulating for those lymph vessels that open and close very slowly. So,
But picture a soft toothbrush, which we recommend, circular or wide, and you're using little circular motions. You're not scrubbing. Scrubbing doesn't help on so many different fronts. And it's cleaning the teeth, it's thinning the biofilm, you're not removing anything. Flossing. Also, if you get the floss in and underneath the gum, I mean, that is, you're 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 so close to the lymph drainage with floss. You really are. And that's how this probably works. We don't know how floss works. We don't know how brushing works. We really don't know. We don't have a lot of studies on it.
I carry floss around in my every purse I own.
There are a lot of dentists that say you don't need to floss because there are no studies. Well, that's a weird argument unto itself, but don't do anything because there isn't a study. The lack of proof is not evidence in itself, right? Anyway, that's kind of what my theory is that there is something to lymph drainage in the gums and in the teeth. And a lot of what we're doing and a lot of what we are doing is good and bad. In other words, there's some things that we probably shouldn't be doing, that we're doing incorrectly, but certainly soft brushing, circular motions with a soft brush, I'm sure has an effect on somewhere on lymph flow in the body.
But, well, so first of all, I just want to say this conversation has helped me fall in love with my teeth.
Dentistry, good.
With dentistry, which I have had a very adverse relationship with. So thank you. I mean, you gave me such a gift today I didn't recognize. All right. So we are now at the segment that I love called In and Out of Flow. So my question to you is, what does being in flow feel like?
Gosh, flow. That is a great question. I think about it often. What is the flow? When am I doing my best work? When am I happiest? When am I feeling good? When I sprint up the stairs or get on my mountain bike? What is working? What isn't? What's a great day of skiing? What's a bad day of skiing, if such a thing? I mean, I think it's really, I don't want to sound too trite, but I think it's two things. Understanding that I am not just one being. In other words, I'm not just a Homo sapien. I am some form of a superorganism. There are all these biomes on board. I don't know who's in charge, but I'm willing to relinquish whatever is needed to keep us both healthy. And so feeding myself, maybe I'm the host, maybe I'm the carrier, I don't know, the driver, maybe I'm the driver, I'm the chauffeur. I mean, just taking care of that aspect of it so that this biome can function. I think biomes do get passed on to successive generations. There's all sorts of wild research on that. I've got grandkids. I want to make sure that that the biome in the family is healthy. I think that's important. The other, and that's doable. I mean, that's to me a very positive flow. Here's the problem. The second part of this is living in my environment with health and without any stress. And it's, microplastics, fluoride, air pollution, things in the water, the plastics that we touch, nylon bristles and floss, little bits breaking off in the mouth. I mean, what are the effects of that? And then being, I'm not a researcher, but I read a lot of research and I'm a clinician, and seeing the effects and understanding what the effects can be, that can be very daunting. So the key is thinking that I'm just doing, if I can do the best that anyone can, that is enough. And just having that notion that is, that can all be, that is all I can do. In other words, that's okay. And so the two fit together. And
I completely, that leads me to, what self-care practices do you lean on when you feel like you're out of flow? Or
yeah, I mean, it's exercise. It's exercise. It's getting out. It is seeing the horizon while walking. That just freshens me up instantly. Eating well, exercising, eating well, and just having fun with people. Being around people and enjoying other people's stories and experiences, and then sharing those experiences. I mean, again, classic answer, right? But we take it for granted because that's most of us. We're working hard, we're commuting, we get home, we're tired, we pull out the quart of ice cream, we sit in front of the TV, we binge watch something, we sleep, we don't sleep well. I mean, that's not a good existence. And so we have to work hard, unfortunately. We have to work hard at being good, good at living and living well. So I mean, it's
That's great. Are such great answers. And, without even using the word stress or de-stress, which is so inflammatory, you're basically talking about the things that do help reduce that stress that can arise from so many different things that are coming at us in our world. So thank you so much for being here today. I have been really excited to meet you. I'm just blown away by all your knowledge, and thank you for again instilling this new love of dentistry. And tell us where we can find you. And I love that you have a link to buy every product. I'm going to go buy every single product.
Well, there's some wild products that you may not need some of them. But for example, if you have had wisdom teeth surgery, there's a specific pillow we recommend to keep your head elevated. I mean, you won't be needing that, right?
So tell us where we can find you.
Instagram, website, everything under Ask the Dentist. Very simple. If you want to read my book on sleep, just type in my last name into Amazon. You'll see it pop up. I mean, it's very lucky that I have a voice and it's easy to find me. Just most hits on Google are Ask the Dentist. So.
And how do you spell your last name?
Burhenne.
Great.
And more to come. Definitely more to come.
Awesome. Thank you so much for being here today. It's been such a pleasure.
Thanks for having me on the show, Lisa. I enjoyed it.